Hi, I'm Noreen Bryson, Regional Training Consultant for SHIBA in Spokane, and I'm here to talk about the 2025 Medicare Plan Finder. Plan Finder can be found on medicare.gov. You can know you're actually in the right place because it has a certification on the top left-hand corner. This is present on all government websites, so if you want to make sure you're where you mean to be, when you're on the Social Security website or any other government website, look for the flag. This is actually a very useful site because we can also log into Medicare.gov accounts from this site. We can do search using the search function to find answers to Medicare questions, or we can use the chat to talk to people when we have questions. On each page, we also have a feedback button that we can use if we notice something wrong with the plan finder or with information on Medicare.gov. We have some options. These change throughout the year on the homepage. And right now they have getting started with Medicare on the main picture, and then we have different functions. And we're going to find health and drug plans. So we're going to find plans now, and that will take us to the Medicare Plan Finder. So this is the Medicare Plan Finder. And for the first few screens, all we do is follow the prompts. First, we're going to enter the zip code. Or alternatively, we would log into a client's account. And we're entering zip code 99203, which is a Spokane zip code, and we're looking for a Medicare drug plan. We could also choose a Medicare Advantage here. We don't suggest using it for Medigap policies because the most reliable information for Medigaps is found on the OIC website or in MyShiba in the publications. So the next selection is, do you get help with your Medicare drug costs? The Plan Finder adjusts for assistance that people get. We're going to say that we don't get any assistance, so we get the full costs. For the search preferences, do you want to see drug costs? If a person isn't taking medications, you can say no here, and you're sent straight to the plant list of plans. There's no pharmacy preferences included or drug costs. If you want to see pharmacies so that they can ensure that they have a pharmacy near them, or they can drive through to pick up their prescriptions when they're coming back from urgent care, then we want to pick yes. And that's what we're going to do today because we're going to enter some drugs. Then we add prescriptions. And our first prescription that we're going to add is lisinopril. When we add prescriptions, we can type in letters and it will it'll auto-generate a list of medications that we can choose from. Clearly, the more letters that we do, the fewer options. It comes in at a default value for the most common dosages. For lisinopril, that's 10 milligrams once a day, and we're going to do monthly fills. So I'm going to add that to the drug list. We can add another drug. We're going to add atorvastatin. This is also a common medication. It's for high cholesterol. We're going to add that. Each field that has a caret can be changed. So the dosage, the most common dosage on atorvastatin is 40 milligrams, but we're going to change it to 20 milligrams each month. But we could do 90 every 3 months or 180 every 6 months. However the client gets it, we can change it that way. I'm choosing every month right now so we can see how consistently the costs are throughout the year. Next, we're going to add gabapentin. This is also a generic used for pain relief, but it's not as common as the lisinopril or atorvastatin. It's generally not a tier 1 medication, so we're going to add that. You get to see on this one that there are many ways that a drug can come. It can come as capsules or tablets or solutions. And so it's important that you make the right choice. Many times, the different forms will have slightly different dosages. So maybe instead of 100 milligram capsules, it would be 105 milligram tablets. But we don't have that on this. So it's very important that we check both the dosage and the form of the medication we're entering. Okay, so we have our 3 medications that we're going to start with, the atorvastatin, the lisinopril, and the gabapentin. We're done adding our drugs. So then we're going to click that and it'll take us to a pharmacy choice. Now on the pharmacy choice page, we can choose up to 5 pharmacies. It defaults to a distance. In this case, it's 5 miles, but there are other ranges that sometimes go up to 50 miles if you're in a rural area. We're going to keep it at 5 miles. And the number right below that, we have the number of pharmacies in range. So there's 61 pharmacies that are in range. And it's showing us numbers 1 through 10. Each page shows mail order pharmacy plus 10 options. So we're going to choose mail order. And then I like to start with the client's pharmacy. In this case, the client is choosing Rose Hours as their preferred pharmacy. So I like to choose that first because that keeps it on the left-hand side of all of our comparisons as the first choice. Then if the client's okay with it, we might want to choose some other pharmacies so that we can see what's available from different networks. And this is, in this case, we'll choose Walmart and Rite Aid. And you can see how it lights up the pins on the map. And then we can also enter a name, and let's choose Costco. You can just type it in. You don't have the drop downs like I do from doing this a bunch of times. And we can find the pharmacies, and it's going to do it within the full distance. So you can see our distance went to 10 miles for Costco's. And I'm going to pick the one on Sprague. So now we have our 5 pharmacies added, and they're all shown in the blue bar. If we wanted to change any of these, we could delete them and add them again. We can just by clicking the X or by unchecking the box up at the top, it changes it. We'll click done, and it will take us to the summary of Part D plans. This is a list of the plans available for the location and the type that we selected. So Spokane, and it's Part D plans because that's what we're looking at. In order of the sort that's selected over on the right, the default sort is lowest drug plus premium cost. So it's ranking these plans based on the client's cost for premiums and co-pays to the pharmacy for the year. We can also sort by the lowest deductible amount or the lowest monthly premium, but we're going to keep this because this is the amount that they'll be paying out of pocket. We have some additional filters. We can sort the plan by the company that's offering it, by the carrier, by star ratings. We can also select, if we are on the wrong plan, we can select to go to Medicare Advantage plans here and apply that. There are more filters on the Medicare Advantage plans. So as we scroll down, we get to the individual plan summaries. And the individual plan summaries are they share basic cost information based on the prescriptions entered and the pharmacies chosen. It's sorting by the lowest drug and premium cost for all of the retail pharmacies chosen. So it's taking whatever the lowest pharmacy cost it can find is what it's using for this, plus the premium cost for the year. Since this is 0, this is all pharmacy costs of $60. And then it has the mail order listed. The mail order pharmacy is up to the company. It's who they have a relationship with. Then we have the deductible. In this case, it has a $590 drug deductible that may or may not apply to the medications on the client's list. Generally, it doesn't apply to Tier 1 and Tier 2 generics. Over on the right-hand side, we have the number of pharmacies that are covered. In 4 of the 4 pharmacies that we selected are in network. We could view them on the details page if we wanted to by clicking here. We also can view the drug coverage from this summary page by clicking. And then on the bottom, we have a green enroll button. If we wanted to go right and enroll in the plan, we could do it from this button, or we can go to plan details, and then we can add to compare. So we're going to add this plan to the compare because it's coming up as our best value. The next plan that we're coming up with is the Cigna Health Saver plan. It's also a 0 premium, just like our WellCare plan. And I'm actually gonna just lower my screen size just a little bit so you can see this on one screen. So this plan also has the 0 premium, so it's the same in that way. And then it has a total drug plus premium cost for the next year. And we are doing this in December, where we're seeing the full year next year. The drug costs for January 1st through December 31st. It's the same $60, but on this plan, you can see we have a $12 mail order cost. So the client can get their prescriptions mail order for $12 for the whole year. That's 4 quarterly fills. Mail orders always quarterly. Okay, we're going to add, this plan also has a $590 deductible, the same. So we're going to add that to the compare. Then we're going to go down a few to the Humana Basic. This plan has a $7.90 a month premium. That means, which is almost $8 a month. So it's $94.80 for the premiums for the year. We multiply this times 12. So of this retail cost, $94.80 or almost $95 of the retail pharmacy cost is the premiums, and then the rest is the copays. This plan also has the same $590 deductible that was on those other plans. We're going to put that in just so you can see how they look side by side. Then we're just going to go up a little bit to show you one other point. And that is the Humana Basic plan right above this one had a $22.40 premium. That means $268.80 of this cost is the plan premium. They're not going to be paying any copays. But they're going to be paying $22.40 a month for the plan. So sometimes it's 6 of one, half a dozen of the other, and sometimes they can have much lower costs by paying a higher premium. But this also has a deductible, so we want to be careful. All right, let's compare these now. So now we're on the side-by-side comparison screen. This gives us a side-by-side view of our 3 plans that we've chosen to look at. The first thing that's shown is back to the plan results. Many of the screens have this. On the previous screen we had that we could go back to the drug and pharmacy costs. When these are available, you want to use them to go back, because if you use the browser back button, it can sometimes throw you out of the plan finder. So you always want to use the back button when it's available. The 3 plan comparison also has the county and state listed on it. And then it has the 3 plans side by side with links to enroll and plan details. Has 2 sections, an overview and the drug coverage and costs. The overview is of the premiums and deductibles and star ratings. The drug coverage and costs shows us if all of the drugs are covered or what number of the drugs that we entered are covered, and the total drug plus premium cost side by side. So if drugs weren't covered, it would show it here. We'd have like 2 of 3, and this we can look at these to say, okay, if they want to go to Rose Hours, of these 3 plans, what's going to be the lowest price? It's going to be the Humana Basic plan. But if they want to go to Walgreens, they can get their lowest cost of all, which is the $60 at a retail pharmacy, the lowest retail cost, right, at Walgreens or Costco. Mail order, again, there's our $12 mail order, and that would be on that Cigna plan. So we're going to look at the Cigna plan because it seems to give us the most versatility for mail order versus retail costs. And since Rose Hours is high, Rite Aid is right across the street, it'll be easy to go to. So our client is most interested in the Cigna plan at this point. So when we click on the details page, we have 3 sections. We have the overview, drug coverage, and star rating. The top of our page is the header, It includes the company, the plan name, and the plan ID number. This is important to keep note of because they can be very similar. It also has links to the website, the non-member number for people who want to call the plan with questions before they join, and a member number for when they have joined. We have the blue ribbon that shows what you'll pay. That's the monthly premium. In this case, it's $0. And what they can expect to pay at a retail pharmacy or mail order. With links to view coverage, this just takes them down the page into that drug coverage section. These are also shortcuts to those sections that we can go to the drug coverage and straight to the drug coverage and the star ratings from those areas. The overview section includes information on the premiums, the deductibles, and the contact information for the plan. And then the second section, the drug coverage section, has 6 different features. It has the drug list where you get the list of all the drugs. If we need to change a drug, if we had put the gabapentin in as a tablet, we could change it from here. We could click this and end up back at the drug information, make our correction, and then when we clicked done, it would take us back to this page. We have some links that show us information on that's related to the topics. So we can click on these links and get a little pop out that explains what they're talking about and close it. Then we have a breakdown of our pharmacy list. And in this case, it shows us where it's in-network or preferred in-network. We don't have any that are out of network, but it would show us that as well. And then we have our yearly drug costs by pharmacy. This is how much they'll pay for each medication at the designated pharmacy. So for their atorvastatin, for the whole year, for all 12 months, they're going to pay $84 over the course of the 12 months. At Walgreens, they're going to pay $0. For the gabapentin, they paid $216 at Rose Hours. At Walgreens, they pay $60. At Rite Aid, they pay $60. Okay. As we go down, we have the total estimated drug plus premium cost. And so that's, again, that number that we've been looking at in the summary, where it's taking the cost for the premiums and the co-pays at the pharmacy and when you meet your deductible. And then we have the estimated total monthly drug cost. And that's our monthly payments that you can expect for co-pays at the pharmacy. They pay $32 a month at Rose Hours every month throughout the year. And at Rite Aid, they're going to pay $5. In this plan, it's very consistent because we have low-cost generics. They're not going to meet the deductibles. They're not going to meet the $2,000 cap on their plans. So they're going to have those co-pays throughout the year. Mail order is always quarterly. You're getting quarterly fills, so you'll see that there's always only 3-month fills over on the mail order. One note is that on the yearly cost by pharmacy, we have information on the Medicare prescription payment plan. There's a link to learn for information to learn about it. And then you can just go back to the left, the tab on the left, and get your plan back open again. And we also have information on what the drug costs might look like if someone did this for a given pharmacy. So this is the cost for if someone did the prescription payment plan for the mail order pharmacy. And here's if they did Rose Hours. And you can see the totals are the same. There's no additional cost for doing the prescription payment plan. But the payments do they increase over time because they're building up as you go along, and that's a formula. So you can always look for that here. It's not generally a viable alternative or a valuable alternative for people unless they have high cost drugs or a high deductible with a high cost drug. As we go down, we're going to look at Rite Aid. After we have our monthly breakdown, we have our estimated drug costs. Let's look at Rite Aid because that's what the client's interested since Rose Hours is much higher. You can see that the retail costs are listed. The cost before the deductible is $0 for these generics. And these would be preferred generics, and then $5 for the gabapentin. Once they get to the out-of-pocket cap, that's $2,000, and that just started this year, and they're going to pay $0, and that's across the board for covered medication. We have an expand button in the blue ribbon here that we can view more drug coverage. This gives us cost by drug tier. And for the preferred retail pharmacy, like Rite Aid, that we just picked, you can see preferred generics are 0. That was our atorvastatin and our lisinopril. And then we have the generic $5 copay. That's the gabapentin. We didn't have any of these, so we didn't have any of these co-insurances. And down below, we have if there's quantity limits or prior authorization required. If a medication is not covered, it would also show here. The loss rating is the star rating, and that's down in the bottom. Wherever we see little plus signs on the plan finder, we can expand and see more information on that. So we can, if we're looking at star ratings, you can look at the drug plan star rating, and then you can see what it is for customer service and the different components that go into it. For member complaints and changes, you can see how they rated it, how the star ratings are broken down. On some of the screens, you can add and make changes in some of the sections on the detail page. We can change our drugs and we can change our pharmacies. On this plan, we're going to change our drug and we're going to add Wegovy. Wegovy is like Ozempic, so it's a common prescription now with for people with diabetes. And the people work their way up in dosage. They start and work their way up. So the maximum dosage is 2.4. We're going to put that in, and a pack of 4 each month. They do injections once a week. So we're going to add that to the drug list. And you can see I did this from the detail page. So when I'm done adding drugs, it's going to take us back to the detail page and look at what just happened to our costs. They went up to $19,000. And if we go back to our search results, to our summary, you're going to see we still have that WellCare as our top selection for the lowest drug plus premium cost sort. And it's also $19,000. When we see this, we know it's a red flag. And it's because it's not covered. See how it's covering 3 of the 4 drugs? Well, our drugs were all covered, 3 of 3 drugs were all covered. It's that we have one that's not covered, and it's the one that we just added, that Wegovy. We also get to see that on the summary, or we get to see it on the yearly drug cost by pharmacy. We get the not covered flag there. We get the not covered flag on the Wegovy when we have the pharmacy breakdown of costs for the different coverage phases. And then if we are in our expanded drug coverage and we're looking at the other drug information where we had our tier information, our quantity limits, and our step prior authorization or step therapy requirements, it's just not covered. So we have 3 different places that we can see that that's not covered. And then we can go back and go back to our search results. And we're going to go back to our drugs and pharmacies, and we're going to take that off. But that's the prescription drug coverage and how the Part D plans look. So let's go back and take that Wegovy off of our list. And now we're going to add Eliquis. You can see it says you successfully removed a drug from your list. We're going to add Eliquis. Eliquis is a common brand name blood thinner that people often go on when they've had a mild stroke or a heart attack or arrhythmia. It's 5 milligrams, 2 a day. Add that to our list. We're done adding drugs. We're going to keep our same 5 pharmacies, so we're going to say we're done there. And now we're going to see that by adding that brand name drug, our deductible is going to apply, and it changed our top selection from the WellCare Zero Premium Plan to the AARP Medicare RX Preferred. That's $83.80 a month, and it has zero drug deductible. 4 of the 4 pharmacies are in network. Okay, and then our second selection is that same Cigna Healthcare Saver Plan that we were looking at before. But our cost went from $60 for the year up to $16.47 because we added the Eliquis and the deductible came into play. So I'm just going to show you really quick how that looks. If you remember, it was $5 a month for all of the prescriptions at Rite Aid, and now we have the first month where with the Eliquis added, where our deductible is being applied, and then we have the co-pays for the Eliquis being added until the client meets the $2,000 maximum, and the costs stop. It goes to zero at the end of the year. You can see here that's saying that they'll meet the deductible in January because we have that high payment up front on the deductible. And our costs for the coverage periods at Rite Aid, once they've met the deductible, their cost is $121.97, basically $122 a month. So $121.97 of this is the Eliquis, and $5 is that same $5 that we were looking at before. All right, so let's go back to our search results. And let's look at Medicare Advantage plans. We can switch to Medicare Advantage plans 2 ways. Once we're in the Plan Finder and we're at Part D plans, we can either select it, we can do the plan type and select Medicare Advantage and apply that. And we can choose HMO or PPO if we wish, or just do Medicare Advantage plans. Or we can look up in the top right corner, you see view 35 available Medicare Advantage plans. Okay, now we've got all 35 Medicare Advantage plans, and it's showing us 10 on the first screen. And you see, if we go up to the top right corner, we can switch right back to the drug plans. That's a handy feature. On our Medicare Advantage plan screens, at the very top, we have the back to drugs and pharmacies. So if we click from here, we're not going back to the Part D plans, we're going to the drugs and pharmacies list. And we can make changes to our list by doing that. Remember, we want to use this, not the browser. We can change our location, and that's important to pay attention that we're in the right county, especially if you have a zip code that covers multiple counties, because Medicare Advantage plans are totally dependent on the county that the person lives in. They get their Medicare Advantage plan based on the county in which they physically reside. Again, the default is our lowest drug plus premium cost. So the default is the same. It's taking our premium plus their copays and ranking them in that order. We have our 4 medications on our list, including the Eliquis, and the Cigna Preferred Medicare is coming up as our first option. Now, right above this, you can see that we have 10 of 35 Medicare Advantage plans, which is what it said in our top right corner, right? But if we want to make sure that we're only looking at plans with Medicare Advantage plans with drug coverage, we can choose our filter to include drug coverage, because there are Medicare Advantage plans without drug coverage that are designed for people who have drug coverage from another source. People have VA coverage, that's creditable Part D coverage. They don't need it in their Medicare Advantage plan. If they have TRICARE coverage, that has creditable prescription drug coverage, they don't need Part D coverage as part of their Medicare Advantage plan. And in fact, they can't. So we want to include Part D. If you include drug coverage, you can see that our 35, I believe it was, just dropped down to 26. So now we only have the plans with drug coverage. Let's add our first plan to the compare. You can see that it's Cigna Preferred Medicare. The second line is the name of the company and the plan ID, also very important when you're looking up information on the website, or if you're just trying to do a Google search to find an explanation of benefits. We have the sort, the retail pharmacy, the mail order pharmacy in this case is in the details. Our third section, other costs, has our health deductible, our drug deductible, and our maximum out of pocket. In this case, it's an HMO plan, so it's $4,200. On the right-hand side, we have common plan benefits, and it has green check marks if they're covered. It has red X's if that benefit is not covered by the plan. We have copays and coinsurance for doctors, for primary cares and specialists, and then whether it includes drug coverage. On this search, we set the filter, so they will all include drug coverage. But on the ones that don't have drug coverage, that are designed for those veterans and others, it'll have a red X there. It does have the enroll button, so we can enroll directly from the summary or go to the details, just like the Part D. Okay. Our second choice is the Humana Gold HMO. Pretty much the same. So we're going to scroll down. A little bit to the AARP Medicare Advantage Essentials. This is an HMO POS, that's HMO Point of Service Plan. So it's a little bit different than that HMO that we picked with the Cigna Preferred. And this one, you still need referrals to go see specialists from your primary care doctor, but they may refer you to a specialist that's out of network for the plan. And in that case, then the plan is going to cover your service with that doctor that you've been referred to by your primary care doctor. This plan doesn't have a health deductible, but it does have a drug deductible. So like on that Part D plan where the $590 was showing in January, we're going to have that drug deductible included in the first month if it applies to the medications on the list. This also has the in-network out-of-pocket maximum. There you can see transportation is not covered by this plan, so it has the red X. Let's add that one to our compare. Now we're going to scroll down just a little bit further. And we're going to add the Humana Choice PPO, because this again is a different type of plan. We have HMOs, HMO POS, and PPOs in Washington. So this gives us all three of them. Our monthly premium again is $0. Our total drug and premium cost is $699.21. This plan has an annual deductible of $110. This is a health deductible. So before they start paying their copays for their health care, they're going to be paying that $110 out of pocket. They also have a $125 drug deductible. This is a PPO, meaning it covers in-network charges and some out-of-network costs. And that, so it has both in-network and in and out-of-network maximum out-of-pockets. Over on the right-hand side, you can see it doesn't offer some of the benefits that the other plans offer, and it has the copays and coinsurance for in-network charges. We're going to add that to compare so you can see. So we have three plans in our comparison ribbon that we can compare. When we hit compare, we're going to get a three-plan comparison just like the Part D. In the header, we have our company name with the type of plan it is, HMO, HMO, POS, PPO. So those are the three different types of plans available in Washington. And we can enroll our plan details from the summary screen, just like we could do with the Part D plan. Our first section on the compare is the overview. That includes star ratings, the deductibles, whether it has a health deductible or a drug plan deductible. It has the maximum out of pocket. So the HMO plans are in-network only. And in this case, the out-of-network that with the referral would probably be applied to the in-network. This one has, the PPO has the in and out-of-network, as well as the in-network maximum out-of-pocket. We have the Part B premium, just as a reminder that you still have to pay it because you must have both A and B in order to have this coverage. But it also has the health and drug premium. In this case, it's zero for both, but plans may have a health or drug premium portion that add up to the total premium. If there is a drug premium and the person has extra help, it is the drug premiums adjusted for the extra help. And it has a side-by-side of the plan features, so you can look side by side to see if the person wanted vision coverage, they'd be able to get it on the Cigna plan and the AARP, but not the Humana plan. You can see the X's and checks side by side. Just be careful because sometimes things don't show up, like you see in-home support services, and they're just not on this list. Next section is benefits and costs. This is primarily for A and B services. So medical services, inpatient and outpatient. The in-network charges are generally copays or dollar amounts, and the out-of-network charges are generally co-insurance. So even on the PPOs, you can see that the in-network have $45 copays and 50% co-insurance, meaning that they're lower cost to be in-network. Emergency care and urgent care is always covered as long as a person is going to a facility that accepts Medicare. So you'll see copays and always covered on that. Inpatient hospital is per day. So this can make a big difference if you have a person who's expecting a surgery. With this plan, they're only going to pay $50. If they're going to be in the hospital for 2 days, they'd only pay $610, $305 times 2. But with this plan, they would pay $990, $495 times 2. For 5 days, this plan, they're only going to pay $1,525. But with this plan, they're going to be paying $2,475. That's quite a big difference for those 5 days of care. So those are things that we look at when we're making plan comparisons. The outpatient is always a range. And so there's more details on this and all of the benefits in the explanation of benefits or the summary of benefits. The third section is extra benefits, and that's a little bit deceiving because it does include those extra benefits that aren't covered by Medicare. The first part covers hearing, the preventative dental, and comprehensive dental for the plans. And then this more extra benefits includes vision coverage, wellness and fitness, and transportation, but it also includes skilled nursing and durable medical equipment and diabetes supplies in that section, which are actually A and B services. Drug coverage and costs is just like Part D. We have whether drugs were covered or not covered and what the total drug and premium are by pharmacy side by side. So if we scroll back up to the top, we can go to the plan details. Or we can enroll. So our last function is to go to the enroll. From an enroll button, you can join the plan. It has the plan name and the plan ID. You can join the plan, and then you can start the application. And you can help our clients with this. A key note on the application page when you're starting the application is you must pick the right enrollment period. If someone's new to Medicare, they'll be right here. But if they have a special enrollment period, you're going to pick their special enrollment period, and they're categorized. Once you've done that, if we have a person who left their, if they are leaving their employer coverage, then it might ask for a date because they have to comply with the 63-day timeline or the other timelines that apply to that special enrollment period. We're going to say that our clients need a Medicare. And then we can click next. Except that there you get to see a mistake because I still had that other checkbox. So I got an error, so it didn't go forward. So the Plan Finder catches you. The rest of it is just following prompts. You'll get an application page, and then after that, you'll have who's applying, and you're going to pick that it's the person getting the coverage or just someone who's just helping, because when it comes to enrollment, you're just hands on a computer for that client, helping them enroll. So that's it for Plan Finder coverage. For how to use the Plan Finder and what's covered in here. For more information on how to use it for counseling and how we actually do plan comparisons, talk to your volunteer coordinator, your mentor, or your RTC. Thank you.